Hey everyone, today we will learn about your liver and a condition called cirrhosis. Totally don't know about cirrhosis? Don't worry, I'm here to break it down for you into simpler terms. Your liver is like a superhero. It does many things. Importantly, it processes nutrients, medicines you take, controls blood sugar, removes harmful toxins and produces proteins that are essential to keep you healthy. So what is cirrhosis? Cirrhosis is when your liver gets scarred irreversibly and hardened, causing it to be unable to do its job properly. So, protecting your liver from cirrhosis is very important. Knowing what cirrhosis is all about can help you identify risks early, prevent early and reduce risk of liver cancer. Now, let's talk about what puts your liver at risk and what causes cirrhosis. The common risk factors of cirrhosis are active alcohol use, untreated hepatitis B or C infections, untreated autoimmune liver disease, fatty liver, being obese or overweight, uncontrolled diabetes, eating unhealthy foods loaded with fats, sugar, salt, and carbohydrates. These sneaky culprits quietly damage your liver over many years. The result? Scarring that lead to liver hardening. This is known as liver cirrhosis. It leads to impaired liver functions and increases the risk of liver cancer. But many cases of cirrhosis can be prevented, and here's what you can work on for a change. First, stop harm. Avoid or at least cut down on alcohol. Your liver will thank you. Get vaccinated against hepatitis B, and practice safe sex by using condoms. If you have hepatitis B or C, take your antiviral medications as prescribed. These medicines can control the virus and protect your liver. Manage your weight with a balanced diet and regular exercise. And if you have diabetes, control it diligently. All these efforts will lead to great returns. It may help to reduce risk of fatty liver and cirrhosis, which reduces risk of liver cancer. Last but not least, go for regular health checkups to catch any liver problems early. Cirrhosis doesn't just mess with your liver. It can lead to other complications. It can cause portal hypertension. Think of your blood vessels as highways carrying blood to your liver. The scarring and hardening in liver is like a traffic jam to the blood flow, causing pressure to build up in your liver, which is called portal hypertension. Portal hypertension can lead to two major problems that we need to watch out for: swollen blood vessels, known as varices, and stomach filled with extra water, known as ascites. Varices are swollen blood vessels in your food pipe and stomach. The tricky thing about varices is that they usually don't cause any symptoms until they suddenly burst and bleed. When that happens, it may present with vomiting of blood and black, sticky or bloody stools. This bleeding can be life-threatening and requires urgent medical treatment. Don't wait, go to the hospital's emergency department and see a doctor right away. For varices, medicines carvedilol or propranolol are prescribed to reduce pressure in the blood vessels and prevent bleeding. But here's the catch. If you feel giddy after taking it, tell your doctor immediately. Now let's talk about ascites. That is when your stomach gets swollen due to water building up inside. You might notice your stomach getting bigger, an increase in your weight, bloating and discomfort. Sometimes, you can get an infection from the ascites. If that happens, you may develop a fever, stomach pain or even vomiting. Again, don't wait. Get medical help immediately. To manage ascites, medicines, spironolactone and furosemide, which are diuretics or water pills, will be given to help you rid of extra water. However, they can put stress on your kidneys, so regular blood tests are a must. And at home, you need to weigh yourself daily. Any rapid weight changes, dizziness or unusually less peeing? Report it to your doctor or pharmacist. And here is the key to controlling ascites. Cut down on your salt intake. Salt in food will retain water in your stomach. This includes soy sauce, processed food and drinks that contain salt. Best if you can prepare food and control the salt level in your food. You should always check the salt content by looking at the sodium level on nutritional labels before you buy or consume any food. Remember, salt is the enemy of cirrhosis. Other cirrhosis complications can affect your brain. When the liver can't remove toxins, These toxins build up in the body and mess with your brain's function. This is a condition called hepatic encephalopathy, HE in short. This condition causes confusion, drowsiness and unusual sleeping patterns, like being sleepy during the day but wide awake at night. In severe scenarios, it can even lead to coma. Now, let's talk about how to manage hepatic encephalopathy. Lactulose, a laxative that works like a gentle broom, helping to sweep toxins out of your body through your bowel movements. To prevent and treat HE, the aim is to have 2 to 3 bowel movements a day. Fewer than 2? You might need a little bit more lactulose. Pass motions more than 3 times or diarrhea. Cut down or stop the lactulose. If any cirrhosis patient, despite an increased lactulose dose, has unusual sleepiness, cannot speak or respond properly, see the doctor right away. Next, there's rifaximin, an antibiotic that works by killing and reducing gut bacteria, which lowers the production of harmful toxins in the intestine and treats hepatic encephalopathy. And here's some tips. Make sure your family knows what symptoms to watch out for, like confusion or unusual sleepiness. They can help by giving you more lactulose quickly and prevent the hepatic encephalopathy if things start to worsen. Always remember to consult your doctor or pharmacist before taking any medications, health supplements or herbal medicines, as they may worsen your liver condition. Alright, I know you're probably feeling a bit tired by now, but hang tight. There's one more important thing you need to know if you have cirrhosis. Your liver, with cirrhosis, becomes slow and grumpy as it may have reduced function when it comes to processing medicines. So painkillers that fall under the category of non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen, atoracoxib and naproxen are to be avoided. NSAIDs very likely will cause acute kidney injury, gastric bleeding and worsen your cirrhosis complications. For pain relief, 4 to 6 tablets of 500 mg tablet of paracetamol per day are safe. And, always consult your doctor and pharmacists for further management. You may think health supplements or herbal medicines may be better and safer for cirrhosis. This is not always true. Health supplements are not able to reverse cirrhosis, and herbal medicines hardly showed benefits. In fact, it may increase the pill burden and drug interactions in cirrhosis. Always remember to consult your doctor before taking any medications, health supplements or herbal medicines, as they may worsen your liver condition. So, prevention is the key. Stop alcohol. Get hepatitis B vaccines, treat and control hepatitis B, C infections. Remember, knowing the risks, making lifestyle changes and seeking medical care early can help keep your body's superhero strong and healthy. We hope you have learned some knowledge about cirrhosis. Thank you.